Notice the practitioner is keeping her back straight. This is to deliver the optimum pressure to the client's body. The practitioner now returning to the standing position at the client's side to work unilaterally on the client's body. The practitioner will again use the forearm at a soft angle to activate the acupressure point GV14 between C7 and T1, holding for 4 to 5 seconds. And now repeating this process on the opposite side of the client's body. The practitioner will cross-fiber friction the tendon attachments on the paraspinal muscles near the transverse process of the cervical spine on the side of the client's neck. And now repeating the process to activate the acupressure points GV20, B10, GV16. From the occiput to the mastoid process. The practitioner will repeat this activation 3 times. The practitioner will now return to the seated position at the head of the massage table, and using the forearm at a soft angle, the practitioner will deliver an effleurage stroke, starting at T1, flowing to the acromion process. To activate the acupressure point GV14 between C7 and T1, holding for 4 to 5 seconds. The practitioner is now standing at the client's side and will begin with a bilateral transition stroke. Light petrissage on both sides of the shoulders and the neck. Begin with the scapula. The practitioner will apply effleurage strokes proximal to distal to the elbow. Be sure to avoid forcing the client's elbow out of normal range of motion in this process. Using the inside hand placed on the client's elbow, use the outside hand to grasp the client's hand, slowly creating internal rotation of the shoulder, and lift the client's hand into the handcuff position. Still continuing to brace the client's hand, the practitioner will use the opposite hand to apply effleurage to the rhomboid and scapula. The practitioner will use the palm of their hand to apply effleurage to the client's lower rhomboid fibers, then continue around the scapula to the acromion process. Now using a soft elbow angle, the practitioner will activate the acupressure point B38 and B36 at the medial border of the scapula on the rhomboid attachment. The practitioner should hold this point for 3 seconds, and then repeat the activation 2 times. The practitioner will now place the client's arm in a relaxed position on the massage table with the palm of the hand facing up. Use the transition stroke to apply the oil to the back of the client's arm. Use the long effleurage stroke to the full arm. Now apply the petrissage stroke to the client's tricep muscle. Repeat this stroke 3 times. Beginning at the elbow, the practitioner will use the thumb points to apply muscle stripping to the client's forearm from the elbow down to the wrist. The practitioner will now return the client's arm to the handcuff position. Using gentle range of motion to stretch the client's shoulder, the practitioner will abduct the client's arm away from the client's body. Beginning at the scapula, the practitioner will use the bilateral palms, applying circular compression strokes. Now moving down the arm to lift and spread and compress the tricep muscle. Repeat this process on the scapula and the tricep 3 times. Working down the medial line, the large intestine meridian of the client's forearm, the client will apply circular strokes with the thumb point, moving down proximal to distal and now the lateral edge of the forearm to the triple warmer meridian. Repeat this process 3 times. The practitioner will apply a spreading stroke down the hand, working their way down each finger to create a pop at the fingertip. Gently stretching in a circular motion, the practitioner will create range of motion in the wrist and hand. And using deportment to again activate the triple warmer meridian. Now moving to the upper back segment, the practitioner now standing near the head of the table, facing the client's body using the forearm to apply a broad flat stroke in a circular motion, moving around the client's scapula. Then with the elbow point, the practitioner will muscle strip the fibers of the rhomboid. The practitioner will repeat this process 3 times. Then use the opposite arm to deliver a broad flat stroke to the client's mid-back. Repeat 3 times. Moving down to the low back. Repeat 3 times. Then down and around the client's hip. Repeat 3 times. Beginning at the client's mid-back, the practitioner will activate the bladder meridian along the paraspinal region. Continuing down the client's paraspinal region, the practitioner will use coarse vibration to rock the base of the spine at the sacral acupressure point B27. Holding compression on the acupressure point B27 for 3 seconds. Then completing another long stroke, returning to the client's shoulder. Repeat this process 3 times. At the end of the 3rd time of repeating the process, the practitioner will slide their elbow down to the client's hip and activate the acupressure point by applying compression for 3 seconds. Now using both arms, the practitioner will apply a spreading technique to the opposite side of the client's low back. The practitioner will repeat this 3 times. Next, the practitioner will use their right elbow to compress the client's glute and repeat 3 times. Then the practitioner, still using the left elbow to deliver compression to the client's mid-back and scapula. The practitioner will deliver a long flat stroke down to the mid-back, again applying the muscle spreading technique to the opposite side of the client's low back. The practitioner will repeat this 3 times. Next, using the client's elbow, practitioner will slide a long flat stroke back up from the client's mid-back into the scapula. Again using the muscle spreading technique, now to the opposite side of the client's low back. The practitioner will use the flat, soft edge of the elbow to apply circular strokes around the hip and the gluteal region, now moving upward from the low back to the mid-back and to the tricep. Using the palm of the hand, the practitioner will apply circular rocking motion to the client's gluteal region. Now rocking the body for 10 seconds. And now, using the palms of the hand, the practitioner will apply a spreading stroke to the same side of the client's body. And using thumb points, the practitioner will use coarse vibration to rock the base of the spine to the sacral acupressure point B27, holding the compression on the acupressure point B27, and using thumb points again to activate the bladder meridian along the paraspinal region of the client's spine, working the way down back to the sacral acupressure point of B27. The practitioner will use coarse vibration to rock the client's spine. Now, using both hands, the practitioner will apply a circular rocking motion bilaterally up the spine to activate the paraspinal bladder meridian. The practitioner will now apply thumb point massage along the spine to the tops of the shoulders, working their way up to the occiput, now to the client's scalp. Gently, the practitioner, without forcing the client's elbow out of normal range of motion, will place the client's arm into the handcuff position, still bracing the client's body. The client's hand, the practitioner will use the opposite hand and arm to apply effleurage to the rhomboid and scapula. Using the soft angle of the elbow, the practitioner will activate the acupressure points B38 and B36 at the medial border of the scapula on the rhomboid attachment. The practitioner will apply a liberal amount of oil to the client's body using a long effleurage stroke. The practitioner will now place the client's arm in a relaxed position on the massage table with the palm facing up. Now applying the petrissage stroke to the client's tricep muscle. The practitioner will repeat this stroke 3 times. Beginning at the elbow, the practitioner will use the thumb point to apply muscle stripping to the client's forearm from the elbow down to the wrist. Working down the medial line, the large intestine meridian of the client's forearm, the practitioner will apply circular strokes with a thumb point moving from proximal to distal down the lateral edge of the forearm, the triple warmer meridian. The practitioner will apply a spreading stroke down the hand, working their way down each finger to create a pop at the fingertip. Gently stretching in a circular motion, the practitioner will create range of motion in the wrist and hand. Again, applying a light tapotement to the scapula, moving proximal to distal down the client's hand.